Let's talk a bit about treatment of tobacco dependence. Treatment of tobacco dependence is a complex disorder, and there are two key components to the treatment. There is the behavioral component, pharmacotherapy. The behavioral component is where an individual must address the habit or the behavioral component of the use. Pharmacotherapy serves to decrease the withdrawal from nicotine and also decrease some of the cravings. Both of these therapies are substantially more effective when they're used in combination. The behavioral treatment is a cornerstone that all pharmacists need to be familiar with for treatment of tobacco dependence. It is recommended that pharmacists undertake a systematic approach frequently referred to as the 5 A's. The 5 A's are an evidence-based, systematic approach to help someone successfully stop using tobacco. These are ask, advise, assess, assist, and arrange, and we'll talk about these in a bit more detail. So for the 5 A's, we should first ask someone if he or she uses tobacco. We should think about all forms of tobacco, not just combustible tobacco or smoking cigarettes. Once we've identified someone who is using tobacco, we then advise the tobacco user to stop. This message should be very clear and personalized. You could link this message to someone's medications. For example, if someone is using a medication that is used to treat COPD, you could say, "I notice, sir, that you're using this inhaler which is commonly used for COPD. Do you smoke or use tobacco?" If the person responds in the affirmative, then you could say, "I'd like to strongly advise you to stop using tobacco. It's the best thing that you can do for your health now or at any time in the future." Then pharmacists assess the readiness to stop. This is where you make an evaluation of someone's motivation to quit using their tobacco product. Some individuals will be ready immediately. They recognize those health risks of using tobacco and the benefits of quitting. Other individuals will still be very linked and very bonded to those pleasurable effects. And these individuals we can still work with to help provide some motivation as to why they might want to discontinue use of that tobacco. Once someone is ready to undergo that process and try to address their tobacco dependent syndrome, then we assist with the process of stopping. And this is through recommending both behavioral modalities as well as pharmacotherapies to treat the tobacco dependence. And always we arrange additional follow-up for this as needed. It's important to remember that tobacco users must develop a plan. Most individuals who are trying to stop smoking or trying to stop using tobacco don't plan to fail in their quit attempt. They fail to develop a plan to address those behaviors. Tobacco is very intensively integrated into most tobacco users' lives. There are specific behaviors, there are specific times of day when someone smokes or uses a form of tobacco. And it's recommended that we help those tobacco users find a specific behavior to replace each time the tobacco had been used. For example, if someone likes to smoke a cigarette with their morning cup of tea, perhaps they could switch to coffee. Perhaps they could have the coffee in a different location to break the routine or break the pattern, which will help them abstain from using that tobacco. It's also important that tobacco users seek out sources of social support. These are individuals that can provide encouragement as they undertake the very difficult process to try to stop using tobacco. These sources of support can include family members, siblings, parents, spouses, friends, colleagues, and even healthcare professionals such as pharmacists.